Hey guys, welcome back to another episode of the SMA Victor Podcast. I am your host, Victor, who is also known online as Victor the Inspiration. Let's get right into today's topic. Today's discussion, we will be going over Biogen's high dose Spinraza benefits. Let's get right into it. So it says the FDA approved high dose of Spinraza for spinal muscular atrophy, showing enhanced efficiency over the standard dose by further increasing SMN levels. It provides faster, more significant improvements in motor function, reduced neurodegeneration, 94% reduction in NFL levels, and reduced risk of death or permanent ventilation. It says key benefits observed in studies include greater motor function, higher, more rapid improvements in motor scores such as HFMSE, RULM, and CHOP-intend for infants and along with patients. Reduced neurodegeneration, a faster and more profound reduction in filaments, light chain, a key marker of nerve damage, was observed at day 64, suggesting faster stabilization of the disease. That's actually really, really huge, which is, what was the percentage here? Oh, I didn't show a percentage. But that's really, really big to show more stabilization within this progressive condition. It says improved survival and reduced risk. Data shows a 68% reduced risk of death or permanent ventilation compared to no treatment, and a 30% reduction compared to the 12 milligram of Spinraza dosage. So that's actually really, really big. It's better respiratory outcomes, fewer serious respiratory events, and lower hospitalization rates for patients. That's really, really big because if you have SMA, such as myself, I have SMA type 2, we have a low immune system, so our respiratory is not the greatest nor the healthiest. Proven safety profile. The higher dose has a well-established safety profile consistent with the previously approved 12 milligram dose with similar adverse events. This high-dose regimen is approved for treating SMA across different ages and types, providing a potential for superior outcomes. This is really, really cool. And let's see if we can get some more information on this. FDA approves new high-dose regimen of Spinraza, Neurosin for spinal muscular atrophy. This became approved on March 31st, I believe it was, or March 30th. This was uploaded on March 30th, but I could have sworn it was on March 31st. Let's go over it. So it says the approval was anchored on data from the pivotal DEVOTE study that investigated the efficiency and safety of the high-dose regimen of Spinraza in treatments. Let's see what else. It says, okay, perfect. That's what I wanted to find out here. So it says, NASDAQ today announced that the high-dose regimen of Spinraza, Neurosin, which is comprised of 50 milligrams, /5 ml, and 28 milligrams /5 ml doses, was approved by the U.S. Food and Drug Administration, which is FDA, for the treatment of spinal muscular atrophy, SMA, backed by more than 10 years of clinical data supporting the low-dose regimen of Spinraza. High-dose Spinraza was designed to deliver a higher concentration of drug through both the loading and maintenance dosing phases to provide a new option in response to the ongoing needs of the community. The high-dose regimen of Spinraza, which will be available in the coming weeks, enables an accelerated loading phase for those new to Spinraza treatment, with two 50 milligram doses administered 14 days apart, followed by 28 milligrams maintenance dose injections every 4 months thereafter. That's what I wanted to know. So the original dosage was 12 milligrams, and now the new dosage for high dose Spinraza is now 28 milligrams. So that is 14, 15, that is 16 extra milligrams that you are getting in addition. So that is more than 50% of more. I'm wrong. That's actually more than double of the dosage, which is really, really cool. That's what I wanted to know. So again, it was originally 12 milligrams that you were getting Spinraza, and now the updated dosage is 28 milligrams. It says patients transitioning from the low dose regimen would follow their existing dosing schedule at 4-month intervals after a single high dose loading phase. Now that was another question of mine because I currently do also take Spinraza myself. I actually just received my 27th injection literally the day it became FDA approved. So unfortunately, I wasn't able to get it just because, although it did get FDA approved, it still has to go through a few more steps afterwards. But when I get my next injection, which should be sometime around in August, most likely I will get this high dose as well. So I'm really, really curious on that. But that's what I was primarily curious on. And when I was doing some research prior to this, in addition, my main question, I'll make another updated video because it's been a few months since I talked about that video. But when I was doing research, okay, well, logically speaking, if you currently received Spinraza at where it was, does this mean with the high dose in Spinraza that it also would increase or more than double your risk factors? And the answer was no. Now, this was according to my research back in December, and you could see that video if you guys want to. So I'm really, really curious to see how this medication is going to be and how this medication is going to benefit not just myself, but a lot of SMA patients and candidates. I think it's going to be such a pretty surreal moment. It says, over the past decade, Biogen has continued to listen, learn, and innovate to help advance care for people living with SMA. Nearly 10 years ago, the approval of Spinraza marked a turning point in SMA care and changed what the community believed was possible, with Biogen becoming a trusted partner for thousands of people living with SMA. Today's approval of high-dose Spinraza makes progress in addressing unmet needs of the SMA community. And then we can we'll end it here. What is Spinraza? So Spinraza is a prescription medication used to treat spinal muscular atrophy, SMA, in pediatric and adult patients. Important safety information. Increased risk of bleeding complications has been observed after administration of similar medications. Your healthcare provider should perform blood tests before you start treatment with Spinraza and before each dose to monitor for signs of these risks. Seek medical attention if unexpected bleeding occurs. Increased risk of kidney damage, including potentially fatal acute inflammation of the kidney, has been observed after administration of similar medicines. Your healthcare provider should perform urine testing before you start treatment with Spinraza and before each dose to monitor for signs of this risk. The most common side effects of Spinraza in the low-dose regimen in infantile and later onset SMA include lower respiratory infection, constipation. I don't know why I'm struggling with this word right now. Constipation. Fever, headache, vomiting, back pain, and post-lumbar puncture syndrome. The most common side effects of Spinraza in the high-dose regimen in infantile onset SMA include ammonia, COVID-19, ammonia aspiration, and malnutrition. COVID-19 was not discovered at the time of the studies for the low-dose regimen. These are not all of the possible side effects of Spinraza. Call your healthcare provider for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. I came across, I've been wanting to make this video. I apologize that I haven't been too consistent with my upload schedule on this YouTube channel. I recently had a book launch that's been going fairly well. I also recently started my own podcast called Become the Victor podcast as well, that's available on YouTube, Apple Podcasts, Spotify, in addition to Apple Music as well. And it's just been such a surreal and exciting moment, but so many different things has also been going on. In addition, I just landed my first speaking opportunity at Valley Children's Hospitals, where I will be speaking for the MDA community, which is a Muscular Dystrophy Association community. So a lot of stuff's been going on behind the scenes, and like a lot of stuff personally and professionally has been going on. So I apologize I haven't been too consistent with my upload schedule, but I do have a backlog of a lot of content, so I kind of gave myself some grace there, where I'm like, okay, you've covered a lot of topics. You're still fulfilling what it is you set out to do, which is spread SMA awareness. So I will be getting back into creating content again for you guys. It will start to become much more consistent. As of right now, I think I'm going to ease into it by uploading once a week on this YouTube channel. And then eventually, hopefully, I'll be able to get back to my normalcy where I can at least start doing every other day, which is like 15 pieces of content a month just on this YouTube channel, just on this podcast. So I really, really appreciate you guys for your understanding. I really, really appreciate you guys for your patience where I haven't been too consistent with my upload schedule. But yeah, if you guys want to keep up and know more about me, what it is that I've been doing, and keep up to date with everything I have been doing. And also I've been competing in an Entrepreneur of Impact that is which is a national competition hosted by Damon John from Shark Tank. So a lot of different stuff going on behind the scenes. And so I apologize for my inconsistency. That's not an excuse, but I genuinely do apologize. So I appreciate your guys' patience. But if you guys want to keep up with my content, keep up with what it is that I have been doing, you guys can check out my Instagram, Victortheinspiration, or you guys could simply even check the links within the description as well. I love you guys. I appreciate you guys. I hope you guys enjoyed today's video. If there is a topic you guys want me to specifically cover, please let me know within the comments down below. And subscribe if you guys are new. We recently just reached 100 incredible subscribers, which is a significant milestone because at one point I started with 0. So to have 106 of you guys currently subscribed genuinely means more than you guys can possibly imagine. I love you guys. I appreciate you guys. And as always, remember, grow through what you go through. Much love.